some of these microbes travel around the body and cause other problems. And we're now up to 57 systemic diseases caused by oral pathogens. And so I thought this is going to become my message for the future. And we in the dental field need to consider thinking about learning how to control the oral microbiome, especially for the disease caries and the disease periodontal disease. I used to think scraping the teeth was the key piece. I can tell you, you are not going to treat periodontal disease with a scaler. It's part of the treatment, but it's not all of the treatment. You need a lot more than that. So any practitioner who says, I can't monetize it, empower your team and turn your team loose and let them help you monetize it, because it will come to you if you have the right language and the right skills. And that's what the Wellness Dentistry Network is about.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 345. My name is Andrew, and thank you so much for being here. If you're a new listener, even if you're an established listener, but if you're a new listener, this is a great one to jump right into. We have Dr. Doug Thompson on today, and he just delivers. It's really fantastic. It's been a little bit of time since he's been on. He's been on before. We got great reviews from him last time, and we're grateful for Machell Hudson for bringing him back on. Next week, and I'll be very interested to hear the feedback on this one. It's going to be a little bit nerdy and a little bit of fun, but we brought on a dear friend of the show, a longtime listener, Melissa Calhoun, and she's going to give us a refresher course on embryology. I feel like every now and again, we do need to do those deep dives back into a subject that, we were there for hygiene school, we remember, or maybe it was part of our prereqs, but then we don't really ever talk about it ever again. So this is one of those episodes I thought would be great to bring it back on and just kind of hear what your thoughts are on it. And Jessica Atkinson was on there with us. We recorded that one at RDH Under One Roof as well. She had great input. It was just made it super interesting. So would love to hear you guys' feedback. And again, I am looking to fill the role of co-host. Again, it's going to be either a permanent or a semi-permanent role. And I really want to be able to make that decision here really soon. So if you've had a favorite guest co-host of, within this last year that we've been doing this solo, or anyone that you think that I should be considering, please drop me an email, andrew@ataleoftwohygienist.com. Let me know what your thoughts are, and I will take that very much into serious consideration. That is all for me for this week. I hope everyone has a great week and enjoy this episode with Dr. Thompson and Machell Hudson.
A tale of two hygienists.
Hey friends, quick pause in the show to remind you about the CE offered for several of our episodes. All you have to do is click into the show notes and follow the link to the CE Zoom website. Answer a few of those questions about the episode correctly, and you'll be rewarded the appropriate amount of CEUs. This wouldn't be possible without a partnership with our friends at Tempstars. Tempstars is more than just a temp and a placement service. They are clinician-led and education-focused and strive to perfectly match individuals and dental offices. Learn more about Tempstars.com or go back and listen to some of their tip episodes. They are absolutely worth the listen. And now, back to the show.
Hello, friends. How are y'all doing?
Good. Thanks for having me on the show today, Machell.
So here's the really exciting news. This is Machell Hudson, and Andrew Johnson clearly has lost his mind because he keeps allowing me to co-host the show.
There's something in the water here in Florida that just makes me start going insane.
The second best part of this is I love that I know the smartest people on the planet. And we are so happy to bring you an amazing guest today, Dr. Doug Thompson, to share an incredible amount of goodness in the way that we all get to practice dentistry. And Doug, thank you so much for being here today.
Thank you so much, Machell, for inviting me. And Andrew, thanks for inviting me as well.
Yeah, welcome back.
I'm excited. Yep.
One of the things that I like, Dr. Thompson, is it's fun, listening to a Tele2 hygienist. Like, I was obviously a fan before I was a friend and a guest co-host. Is I loved learning how everyone that Andrew and how Machell used to, and Andrew still does, you get to see the human side, the non-clinical side of the guest. And when I first joined AOSH and was learning from you, it was incredible, and I felt so lucky. And then I got to know you on a personal level, and you are my friend. And how much you love dentistry and integrative dentistry, and you love helping people, and that's the best part of you, is that your heart is so good.
Well, thank you, Machell. It's really been an honor to go down the pathway and take this journey that I've taken. I never started out this way. I didn't know, I was a crown and bridge technician for 12 years before I became a dentist. So, I was all about restorations, and I was I had a pretty nice job as a ceramist, and, I liked that. And it really encouraged me. I felt like I could do more and do more with my own career. So I wanted to advance beyond dental technology. And so I took night courses and got the prerequisites for dental school and got into University of Michigan when I was 28, and graduated from dental school. And I thought it was going to be all about crowns and bridges and veneers and implant restorations. At the time, were really sophomoric, but there was Brandemark had some implants going. And lo and behold, I got fascinated with microbiology. And the whole microbiology fascination took me to a path to start to learn that some of these microbes travel around the body and cause other problems. And we're now up to 57 systemic diseases caused by oral pathogens. And so I thought this is going to become my message for the future. And we in the dental field need to consider thinking about learning how to control the oral microbiome, especially for the disease caries and the disease periodontal disease. And if we could get a handle on that, get a grip on that, and maybe learn how to do a better job, we wouldn't have so many sick people. Because when you talk about the human side, Machell, of my practice, when I bought my first practice, I had no full mouth series of radiographs. I had no perio charts. I had no perio probes in the exam kits. I had a practice that was doing very well from a restorative dentistry standpoint, but wasn't really up to par with what I had learned at Michigan about how to manage periodontal disease. And so I started to think about and create a vision of what could this look like for our practice and how could it be better. And what happened when I started to look at periodontal disease and how this happens, it was impossible for me to not look at the rest of the body. And so I got interested in some functional medicine and took a few weekend courses, which anyone can do, and started to learn that inflammation was the key word way back in 2006. Inflammation was the key word. And then it was, what could I do in my practice to help me manage patients that had other areas of inflammation? And how could I coach and guide them to be healthier? Maybe just to be healthier. They don't have to be perfect, but just to be healthier. And that's where this whole journey started. And then I've met fine people like you, great hygiene teams, great hygienists. I mean, our hygienists are amazing people, and Andrew, amazing people in the world of preventive healthcare. And what a great opportunity hygienists have if they have an awareness of how serious this periodontal disease situation is, which is really a medical disease with a dental solution. And it's really, really a big disease. And so I want to be an ambassador for helping people create more awareness about what to do, how to do it, how to communicate with patients, and how to help patients be healthier beyond the teeth. That's the whole idea.
I love it. I was so blessed to get to take your first course, perio course, and it was incredible. And I love learning from doctors like you, but a lot of people don't know that hygienists can actually go through your wellness network or through COIS to learn how to practice whole body dentistry. And a lot of our profession still doesn't understand what that really looks like. Dr. Thompson, will you kind of walk through what integrative dentistry looks like when you have a new patient? How are you looking at each of your patients that sit in your chair?
Yeah, I had a unique experience in 2002. I think one of my friends mentioned the Koi Center in Seattle, Eddie Borio, and Ed said to me, and I always looked for some of the basically elite professionals that are in our profession, and I always wanted to seek out their teaching or learn from them. You really want to surround yourself with people who, if you can, that can help guide you and groom you. And so when I was a sophomore in dental school, because of my lab background, I knew about John Kois. And I started to study with John Kois. And John Kois developed an amazing system for how to break down or for how to categorize certain topics with the new patient exam. So things like gum disease, things like environmental damage to the teeth, which we would call biomechanics, things that structurally compromise the teeth, caries and, the caries infection, and function, how the teeth come together and work together and how the teeth appear in the face. And he started to break the whole human being down. And we're all working on human beings, unless you're a veterinary dentist. We're all working on human beings. And so he started to break the human being down into these sections. And then I just kind of further subcategorize these sections. So we have 7 key areas that we look at every single new patient in with distinct eyes and looking for sources for disease. And so when a new patient comes to me, we have a 1-hour clinical exam. It can start in the hygiene room if our hygienists are prepared with the huddle, or it can start in my room. Now, in the operatory. Now, I want to back up for a minute, but I want to conclude the remainder of the story. So John Kois developed this amazing system. And what I did is I kind of blown out the periodontal part of the system, and I've fixed and I've collaborated with and connected it to several other systemic issues that we can help the patient with. For instance, sleep apnea. That wasn't on our radar 15 years ago. Sleep apnea, we weren't talking about sleep apnea the way we are now. We weren't talking about heart disease the way we're talking about it now. We weren't talking about diabetes or metabolic issues the way we're talking about it now. We just didn't know. And now we do know. And so my system really piggybacks on John's original system, which breaks the human being down. I just broken it out even further. And then we have a whole lifestyle piece. But to your point, why can people come into the practice through hygiene, or why can they come into the practice through my operatory? One of the things we started to do during the COVID days was we started to do a virtual exam with all new patients. And so we do about a 15-minute virtual exam with all new patients, and it can be any of the doctors. Chelsea Watkins is my practice partner right now. And Chelsea or I can do a Zoom meeting with new patients. And the Zoom meeting basically reviews the medical and dental history. And if anybody hasn't taken a COIS course, and Machell, I'm going to be really biased towards the COIS Center because I love that teaching institute and what it represents, excellence in dentistry and increased predictability. And John's given me the ability to teach my own two-day hygiene course there. So I know he believes in and understands the message that we're supporting. So what we do this virtual exam and this virtual discussion, and that's where I find out what their past dental history's been. How many times do they typically go to the dentist? What kind of toothpaste do they use? Do they use any oral rinses? When was the last time they had a cavity? Because that's a really big thing for X-ray frequency. So how excited do I need to get about, do I have new X-rays? Do I have X-rays that are a year old? Or, what do I have? What can I use? And then we talk to the patients about notching along the gum line of their teeth. And we talk to them about bite disease or wear on their teeth. And we ask them a few basic questions. And then we let them know, hey, you're going to pay a fee when you come in for a comprehensive exam. I may need some radiographs that day based on the discussion we're having. It looks like I need to start with a clean full set. Are you okay with that? Here's how much they cost. And then oh, by the way, you're going to see Machell first. And then I'm going to spend a half an hour with you after summarizing, because she's really our gum disease expert in the practice. She's our hygiene team, and she's going to evaluate you first. Then I'm going to piggyback on what she finds. But all these things, do you have a practitioner preference? How did you get to the practice? I mean, it takes about 15 minutes in a real nice, succinct way. We have a virtual exam template, and it's really nice because it starts to become the framework for the first patient visit note, but it's built off the COI's medical and dental history, which is very compartmentalized into certain categories. So it's an organized fashion. It's swift. It's complete. It allows me to write a beautiful written assessment that I can write in 5 to 10 minutes at the end of the appointment. And so the patient has a real clear understanding. And I can't tell you how many times, Machell, patients get up out of the chair and say, I've never been evaluated like this before, because it makes intuitive sense to them. And that's what's really the key. So it's allowed us to relate to people differently than I used to relate to them when I was going through all this dental jargon and they had no idea what I was talking about. So it's really, really been nice. So it's a long answer to your question, like what's the new patient exam look like? But it starts with a virtual exam. We clarify expectations. They get a feel for what my practice is. And I tell them point blank, if you have bleeding gums, our hygiene team, our periodontal therapists are not going to let you out of the office without having some kind of discussion about that. And they expect it. And they expect it. And I think it's eased the communication burden for the hygiene team. Because Machell, how much did you hate it when you had a patient that comes in and they said, I've only seen a dentist once every 2 years, maybe even once a year, and they have 75 sites of bleeding, and now you have to start some kind of discussion. I think that's hard for our hygienists.
It is. Yeah. I also think that, when you're talking about any sort of treatment planning, there's what do they say? The number one reason why people don't follow through with their treatment planning is because they don't see the value in what we're doing. You're creating so much value right at the beginning that even if I'd happily pay for, full mouth series, comprehensive exam, because you spent the time with me, really getting to know me. And I know that my disease will be managed in a professional way. You don't get that in most dental offices.
Yeah, the lack of understanding is the problem, and you're taking that out of the equation.
Yeah, and I think that virtual exam could be done by anybody in the office that has good verbal skills to discuss how our practice works. Now it has a lot of credibility when it's coming from me or from Dr. Watkins. There's no question that we add credibility to it, but I just can't tell you how much it's facilitated some of those initial discussions. And we have people that come in and they say, well, I have a lot of bleeding now. I guess you told me on the phone I was now going to need a salivary diagnostics test, and I'm okay with that now. But just think about all the communication that you don't have to do at that hour appointment. And what I think is important for the patient to come away with from the new patient visit is an assessment. It doesn't have to be a total treatment plan. It has to be an assessment. What did you find? Hey, I found some problems here. It's going to investigate. It's going to take some further data gathering and some further investigation. But, this is a problem that I think we can get well under control. But I need some other data. I need to take some salivary diagnostic data so I know how to treat you. I can't decide right now. I have no idea. And you know what I didn't know, Machell, when I started to be fascinated with microbiology? I thought it was all about bacteria. And now I know it's about bacteria, yeast, and viruses. And if those two words are new to you as a hygienist, yeast and viruses, start looking at the recent literature. It's amazing how much is out there. And about 40% of my infected cases have a yeast component to them. And almost all of the aggressive cases have a viral component to them. And what happens when you give a yeast patient antibiotics? It gets worse. So if you're not having great treatment success, start thinking maybe we're not measuring just the right thing if we're only looking at bacteria.
Will you talk about that for just a minute? That was one of the things, Andrew, did I not say? I hope he talks about Candida. Because that really is a big deal. And the importance of, two things. The importance of salivary diagnostics, not only to look at these moderate and high risk perio-pathogens, but that Candida piece as well. So if you'll spend some time.
Yeah, I would, people will know me as saying yeast is a beast. I mean, it's really hard to treat. It causes a lot of problem. And what it is, it's synergistic, meaning that it like piggybacks with bacteria, and it helps form a thicker lattice work on the teeth, a biofilm lattice work that's harder to penetrate, harder for medicines to get through to it. We know when it teams up with strep mutans, it causes a lot of havoc for children and childhood caries. We have papers to support that. Yeast is a big problem, but it wasn't on our radar. And what's caused the problem, Machell, for us with yeast is our sugar intake. So we have so much sugar intake today. And if you think about the sugar intake, how different it is from even 50 years ago, it's really a lot different. And so a lot of us have a yeast imbalance because the yeast love refined sugars. And so they overgrow, or we've been exposed to antibiotics in our meat and our food sources. We've been exposed to antibiotics in other ways from polypharmacy and our physicians' offices and other places. And so our guts and our bodies are a little bit more imbalanced as a general population. And we have a big problem with yeast. And what happens with yeast is there's several different types of Candida. There's up to 9 different types now of Candida. And the Oral DNA company, and I don't know if I can use company names on the radio, but I'm going to because I love that company for that. The Oral DNA company has a yeast test. And, I'm going to back up for just 1 second. We talk about salivary diagnostics. It's basically just taking a saliva sample, looking at the saliva sample and seeing what's in it. And these companies now know the DNA address of the certain bacteria, yeast, or viruses. So it's a very targeted look at, do you have some of the things that cause the most aggressive disease? And if you do, in general, and what I mean by that, Machell, is most of these tests and Andrew, most of these tests are broken up into high-risk pathogens, moderate-risk pathogens, and low-risk pathogens. And if you have a person that seems to even be relatively clinically sound, and they have a high level of high-risk pathogens, I can guarantee you there's some downstream cardiovascular biomarker or some other health biomarker that's altered by even the presence of those high-risk pathogens. And I'm talking about the ones you've heard in periodontal medicine: Porphyromonas gingivalis, Tannerella forsythia, Treponema denticola, and Fusobacterium nucleatum, and AA, that big long one that I can't even say the name. So you get it. I mean, these are the high-risk pathogens. And if you have these in high numbers, you need to do something about it, because they have different pathogenicity. Well, guess what? Yeast has that now too. There's 9 different types of yeast that oral DNA tests for. So when I have a patient that has a problem, I'm testing for bacteria. I want to know, do you have those high-risk bacteria? Do you have high levels of even some of our moderate risk bacteria? And if you do, then I need to do something to help you manage the biofilm, because I know it's not only is it not healthy for your teeth, it's not healthy for your body. Now, what if yeast is piled on that? If yeast is piled on that, everything's more difficult to treat. Everything's more difficult to treat, and everything's more difficult for the patient because it could cause more systemic issue. So here's why I use salivary diagnostics, looking at what's in the saliva. I don't do it to determine if you have disease. You periodontal therapists tell me that by probing chart and the response to probing. If you have line bleeding on probing, you have inflammation. What's driving that inflammation is a sulcular oral microbiota that's not so healthy, or you have a very weakened immune system, one of the two. And our future is going to be working on both, learning how to control the oral microbiota and learning how to balance the immune system and how to boost the immune system so that we can make you more resistant. That's the idea. And the salivary diagnostics is a key piece so we can figure out what you have. In yeast, it's critical. I don't even consider taking oral pathogen test anymore without adding yeast to it, because about 40% of my cases have yeast involved, and it's hard to treat. And just for your hygienists that are all listening, I think that, and I feel compassionate for hygienists that work their hearts out trying to scale and root plane and scrape the teeth and debride the teeth and guide the patient to better home care only when the patient doesn't get better. And there's nothing that makes me more disappointed. And I know the hygienists take that personally, but I can tell you it's not your fault. What's the fault? It's the fault of is our lack of understanding of what the disease process is and how to target it with the right therapeutics. And that's what the 2-day hygiene course at the Coy Center is all about. It's about how to identify, how to discuss, how to treat, and how to maintain these complex diseases that are way more than what we thought they were. I used to think scraping the teeth was the key piece. I can tell you, you are not going to treat periodontal disease with a scaler. It's part of the treatment, but it's not all of the treatment. You need a lot more than that. And we could talk for 2 days about that. That's how long the course is.
You could actually, I mean, you could even break that course. That course could be a week-long course. It's an amazing course. Everyone should take it, by the way, and talk to your doctors about it. It's worth every penny the takeaway from that course. And then if you'll spend, I would love for you to share, the organization that you created, Doug, which I think is, we at the American Academy for Oral and Systemic Health, it is a collaborative organization, and healthcare is broken. And one of the reasons that healthcare is so broken is that everyone a lot of our patients, because we are a sick country, has, 10 different doctors. They have a cardiologist, they have an endocrinologist, they have their dentist, but they're not working together. And so what happens? Our patients stay sick. Doug has created a group where he's bringing physicians and dentists together and to work together and to help get our patients healthy. So if you'll talk to us about that.
Yeah, Machell, thank you for mentioning the Wellness Dentistry Network. And for anybody that's interested, you could go to wellnessdentistrynetwork.com and gain more information. But I had a problem when I started to teach or started to share. And I guess I have to use the word teach because I think that's what it is. But I'm just really sharing my story and my journey and what I learned along the way. I'm not a researcher. I don't have a PhD in research. I don't have a research lab. I have a clinic. I have an office where I work on real people. And I've had to work on real people and figure out what works and what doesn't work on real people. And then my friends would say, and here's what I needed to do, Machell. I needed to have a way to educate the patient population. So I created a lot of 1-day or 1-page informational pieces that would alert a patient about gum disease, alert a patient about yeast, alert a patient about their exposure to pollutants, alert a patient about their exposure to mercury, alert a patient about supplementation and why supplementation is important in certain ways, alert a patient about all these areas of what we call wellness dentistry. And there's 23 different modules in the library, but I needed a way to get this information to my friends. So instead of having 25 Dropbox folders on my computer and sharing all these forms that I was changing radically as the science changed, I developed a thing called the Wellness Dentistry Network, which is basically a subscription resource hub that has a lot of information automatically branded for your practice. It has a low entry cost under $3,000 for the first year, $1,500 for every year thereafter. It's not expensive. But what it does is it gives you an immediate library of materials that you can use to share with your patient. Kind of like we have a campaign called Health Measurables That Matter. Like, how do we tell our patients what the heck matters? And so how we do it is with small little handout pieces that are not difficult to read. They don't take a lot of time. Now, here's what's hard about that. We have very complex procedures that we need to do in practice. These biofilm diseases are not easy to manage. So you need a way to figure out what your treatment plan is going to be. How are you going to recommend it to the patient? What are you going to take into the consultation room? Are you going to call the physician and talk to a physician on the phone? And all these things require some organizational structure. So all the forms, all the different pieces that are involved in all these different areas of dentistry are part of what continues to build in the Wellness Dentistry Network. And the Wellness Dentistry Network library is dynamic. I added an article yesterday. I added a form yesterday. So anytime we add something, anybody who's subscribed gets that stuff automatically updated. And then we do monthly webinars. I have one tomorrow night, Monday night. We do a monthly webinar, an update about what's new. Tomorrow, I'm answering commonly asked questions in the Wellness Dentistry Network. If some people want to, maybe if they want to email me at contact@wellnessdentistrynetwork.com. I know this won't be out, but maybe we could figure out a way for them to hear a sampling of what we do on our webinars. But it's somehow to keep people updated as to what's going on if they want to be involved in the wellness dentistry push. And you could focus just on cavities, caries management, periodontal disease management, sleep medicine, sleep apnea management, and a few other areas. But if you want to branch out and help your patients with, insulin resistance and metabolic syndrome and diabetes and hydration and exercise and nutrition and all these other areas, then we need some guidance. And the idea is I wanted to create a library that had information for people that wanted to go in any direction they wanted. So if you want to jump in and start studying yeast management, we have a yeast module. If you want to start studying pollution, we have pollution, heavy metals, environmental pollutions, and do not discount electromagnetic radiation pollution. I have many patients with Lyme disease that are very sensitive to EMF pollution. And don't ever look at somebody that says, I'm sensitive to the electromagnetic frequencies in this room and laugh at them and think it's a joke. These people have a serious issue with how their bodies are sensitive to electromagnetic frequency radiation. I had no idea it even existed not that long ago. And so these are all areas. This is what wellness dentistry is about. It's about us knowing that some of these things affect people in another way and we can help them. You know why? Because you said it perfectly in the beginning. Healthcare is so fragmented that physicians do not have time to comprehensively go through this with their patients. So where could they learn this? They're in your office for an hour. They're in your office for 45 minutes. They're in your office for a half an hour at least. And so what a great way if your hygiene team, your assisting team, and your office staff, your office team knows a little bit about some of these areas. And you could say, I don't really know all the stuff, but maybe we could help you if you looked at this. And so this is the genesis of the Wellness Dentistry Network. We have about 165 offices around the world. We have Australia, England, Spain, New Zealand, Canada, offices all over that are all interested in going down this road. And in Machell, it's not perfect. It's a little clunky because I designed it to get my friends forms, but it's really a nice system to be a part of. And then we have a section called Partners in Health. And Partners in Health are physicians that are aligned with the language. What's the worst thing a person could do in their community is send a patient to a physician with a salivary diagnostics test. And the physician says, well, this doesn't mean anything to me. This is no good to me, or this is not important. Or inflammatory biomarkers that Brad Bale and Amy Doneen talk about, and Ford Brewer talks about, and Teradal talks about, and or sleep medicine statistics that Jerry Simmons talks about in Texas. And, some of these experts around the country. How do we network these people? I'm trying to network them one person at a time. And it's working really, really well, but it's not where I want it to be. And we need more people to be involved.
I love it. I think for us, there's never a question. No one questions how much we love our profession and how purposeful we feel. So I see so often, and I ask, hygienist, and Dr. Chris Kammer said, start asking the dentist, what is a hygienist? And hygienist, well, I just clean teeth. Or I'm just a hygienist. I'm just a hygienist. And then I listened to Chris and I started asking my doctors that I work with, I'm just a dentist. Just to sit here and listen to you, that is not a just. That is purpose. That is saving lives every single day. That's enriching.
Yeah, I used to think it was a little bit of as a matter of fact, I used to kind of downplay it a little bit. And I thought it was a little bit of a joke because early on in 2009, when I was really starting to perfect the perio therapy protocol, I started in 2006, really working on it hard. But in 2009, someone wrote me a note and said, "Thank you for saving my life." And I used to just kind of joke about it. I would think like that was kind of silly. Like, why would she write that? And now I can't tell you how many people say to me, or pull me aside or pull one of our team members aside and say, it's amazing that I can have a discussion, a more meaningful discussion in this office about my overall health than I can with my physician or than I can with anybody else. So, Machell, what I would say to your comments is I'm humbled by the opportunity, but we have to learn a little bit more about it. And here's the problem for dentists. Dentists are making so much money drilling and filling and doing implant restorations and doing complex restorative care, which I appreciate. Fixing the teeth and mechanically working on the teeth is really hard. But what I hope the Wellness Dentistry Network will do is empower people like you and empower people like Andrew and people and our other hygiene team, our hygienists and our therapists. And what about our assistants? I have a 21-year-old assistant right now who has taken a hiatus from college. And you never know what he's going to say if he's armed with a little bit of knowledge, what he's going to say to somebody that causes them to drink more water, that is, causes them to eat more of the right food, causes them to sleep better, causes them to make a health change that's meaningful in their life. And then when they come back into the office a few months later and say, it's amazing how good I feel after this happened. So not only do I have people who have told me how meaningful the message is in my life, but I'm going to share something with you that totally blew me away that only happened to me a month ago. I had a patient tell me they loved the message from our practice. My practice is called Integrative Oral Medicine. And I changed the name of it back in 2009 when I first became really passionate about the relationship. And I started to create a better, stronger message. What's the integrative dentist? Because I don't have biologic dentistry credentials. I don't know that there's a specialty called biologic dentistry or holistic dentistry or whatever. I mean, we just happen to be dentists who have a very keen awareness about how oral conditions affect systemic health, and we talk to our patients about it. And we network with physicians when we see there's an imbalance somewhere. That's how we do it. And so what I started to do is just talk to patients that way, and it resonated with them. And they could somewhat understand how the mouth and the body's integrated. Well, I had a patient that was so moved by the message. She recently said, "What do you want for your practice?" She asked me, could she spend some time talking to me at lunchtime? And so I took one lunch appointment and I spent about 45 minutes talking to her. And she said, "What's your wish list for your practice? What do you want for your practice? What do you want for the future for your practice?" And I didn't know what she meant. And I said, "Do you mean like vision wise or like equipment wise?" And I said, "The price of technology is very expensive, costs a lot of money, and it's very expensive, but there's a lot of things. We'll have a wish list. I want an intraoral scanner. I want a printer. I want a Erbium mag laser. All that you name it, whatever you want." But you know what, Machell? I opened an envelope on April 21st of this year, and it had a check in it for more than 6 figures. And it was a gift to my practice because this patient liked the message. So I can't tell you, if anyone ever comes to me and says you can't monetize wellness dentistry, I'll tell you about patients who came to my practice because they had elevated A1C and they spent $37,000 in the practice. I'll tell you about a patient who came to my practice because they wanted a practitioner who understood a bypass graft and how to manage it, and he spent $68,000 in my practice. So I can tell you about plenty of patients when they come to you and they're sick, and you develop a reputation in the community of being somebody who can treat these patients with respect and dignity and get them to the finish line. Believe me, they'll come to you, and the patients they'll come to you. They have other needs. They don't just have a cavity. They have lots of needs. So any practitioner who says, "I can't monetize it," empower your team and turn your team loose and let them help you monetize it, because it will come to you if you have the right language and the right skills. And that's what the Wellness Dentistry Network is about, grooming people to go on that journey. It's a journey. It's not a weekend course. It's a journey, and you decide this is where I want my practice to go. And I can tell you it's the future of dentistry, because no one's more poised than we are to take it this way. And I don't, I know you can't see me on video, but you don't need to know I'm passionate about this. It's the future of dentistry.
It's beautiful.
It is beautiful. I love I adore you, Doug, and I love what you do, and you're an incredible teacher. And I mean, I've left Doug a message, and he's called me back the same day, and he has spent. I mean, he doesn't even, Machell, I've got 5 minutes. He doesn't do that. He spends time helping me understand disease process. And I thank you for that. That's what we need, because this is scary. I would hope that we all want to be better. We're healthcare professionals, but it's scary to think, because this is really big. Am I wrong, Doug? This is really, really big.
No, it's super big. It's super big.
We have to have doctors and experts like you to hold our hand and guide us to where you are now. So I really am so grateful for you spending time with Andrew and myself and all the listeners, educating us on how to do this. And if listeners wanted to reach out to you, how do they do that, Doug?
Yeah, the best thing to do, Machell, and in transparency, I know you said I do want to spend time, and I'll spend time. We'll get to people as we can. But Machell, where, I have a teaching position at the Coy Center. We have our practice. We have the Wellness Dentistry Network. And so the best way to get to me is contact, CONTACT, at wellnessdentistrynetwork.com. And if you email contact at wellnessdentistrynetwork.com, there's some other eyes on that email, because Machell, you can get buried.
Yes.
Right?
Yes.
You can get buried. So,
yeah.
Yeah, and that's okay, because it happens to all of us. So contact at wellnessdentistrynetwork.com. And if we don't respond, reach out again, but our goal is to respond. And we have a team of people that are helping to respond to requests. We would love to work with people out there. I think one of the things that's hard for our hygienists is the hygienists are so passionate and such skilled care providers and have such a responsibility. I hate that when you have a passionate hygienist and it falls on the deaf ears of a dentist. And so that's hard, because I know the hygienists in a lot of practices can't make the purchasing decision. But I would hope that somehow you could get the message across to your dentist that this is something that could be hygiene driven. It could be doctor led. It could be hygiene driven. We just need to create the right vision, and we need passionate people like you and Andrew who will execute when there's a sick person in the chair, because I can tell you, nobody wants to be sick. They all want to be healthy. And if you offer them options to be healthy, they will trust you, and they'll come to you, and they'll trust you, and they'll look forward to the appointments, and you'll have less cancellations. You'll have less no-shows. You'll have more cooperative people, and it will be a rewarding way to practice. It just creates more joy in practice. And that's what I'm looking for. I want my day to be happy. And all my patients, we come in and have these discussions. It creates a lot of joy.
That is the definition of joy, being able to take great care of our patients. I'm transitioning out of my practice because I'm moving, and the one I'm hearing consistently is, who's going to take care of me the way that you take care of me?
For sure.
I encourage everyone listening to this, take your doctors and go and learn from Doug at Coyce, and go to the American Academy of Oral and Systemic Health.
Correct.
Get involved in these mouth-body organizations and learn how to collaborate with physicians. And not only will it change your life, but it changes the life of everybody around you. And there is no greater joy.
Thank you so much, you guys. I really appreciate you having interest in this topic. I think it's an amazing opportunity for our dental teams.
Yeah,
thank you, Doug.
Well. Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one. bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening and preventing gum disease. We're gonna do a lot of learning and have a little bit of fun working at the dentist. A tale of two hygienists.